Well, good morning. My name is Randy Edens, and Dr. Roadhouse and Dr. Cave asked me to speak a little bit about my condition and the process to it. I'll make it short on the build-up, but it's all important to where I am now, and you'll understand after I'm through, I think. In 2011, I went to a doctor with hip problems. First, I went to a chiropractor, worked for about 6 months, then went to a hip doctor and a back doctor, thinking it was my back, and it wasn't. It was a wore-out hip, so we replaced it. Went very fine. It was just wore out, like I say. Went through rehab. About 18 months later, my doctor called me and said there was a recall on the hip, and it was across the board. 2 hips were recalled by the manufacturer, and mine was one of them. I had no symptoms as to problems with it. It did not hurt, but he said, let's just see if it goes on that way, or we'll know in MRIs. So we took 4 MRIs 6 months apart. And at the 5th one, he said, let's reschedule and regroup. Said it doesn't need to stay in there with those dissimilar metals. They're causing a problem, and we don't want it to get in the blood. So during this time of these 2 surgeries, after I had my hip replaced, I noticed that my feet, my toes especially, were becoming very sensitive to touch, and shoes of tightness, sandals even open, with bending the toes. Didn't pay much attention to them. I thought I was just getting older. Then I started being so concerned about it, I went to another opportunity to treat a situation I've learned to call neuropathy. That was in 2015, somewhere in there. That was unsuccessful. It was an expensive program, and it had a lot of activities other than what I was in there for. I didn't need, in my opinion, to go through all of those, and I canceled out and removed myself from it. Then just recently, I got an invitation to go to a workshop of Dr. Roadhouse, and it was dealing, and it stated neuropathy. So I reluctantly went, heard his presentation with assistance of some of his qualified girls that he had working with him at the lunch, and came in, had a personal visit with him, talked about some pretty straight things as to what I experienced, and the disappointment I was having, and the reluctance I had in believing what I'm hearing, and he convinced me to move forward with his procedure. It was unlike anything I had heard before, to the point that he says, we can fix this. We're working with a different set of approaches, chiropractic and neurological, I guess that's the word is. So we started with that. He explained how we would do, and we did. I'm in my 4th, going into the 5th week, and he asked me the other day in front of one of the other customers or patients or clients, whatever you're going to refer it to, as to what my condition was and how do I feel on a scale of 1 to 10. And I said, well, Dr. Bryan, I don't work on a scale of 1 to 10. I'm not smart enough. 1 is the good end and 10's the bad end. And he said, yes, that's right. Go ahead, Randy. So I told the lady, I went through a little program, and I told her, I said, when I came in here 5 weeks ago, I had the big symptoms, the big hurt, and the big disappointment. Now then, I guess with a scale of 1 to 10, I'm probably at about a 7 or an 8 in that short a period of time, and I refer to my condition as having happy feet. I have happy feet now, and I am tickled to death. I don't mind him showing this to anybody that has questions or reservations, but what I've learned from him is I've even brought a son in. He's 51, and he has advanced neuropathy, and he's a believer, and it's hard to get him to be a believer, but he's understanding as to what his shortage of maneuverability and getting along without a crutch or a cane or a wheelchair later on in the years, because this doesn't cure itself. I've learned that in search over the years. I appreciate the time and the opportunity, and the people who are working with me. It's so important to my life and my wife and my children and grandchildren. Thank you, and good luck to your future and your decisions with regards to your health. Thank you.